Welcome to Healthcare Forward, where industry leaders, benefit advisors, and healthcare professionals come together and discuss the changing landscape of commercial health plans. Brought to you by Roundstone Insurance, the first group captive for health insurance, where smarter self-funding meets long-term savings. I'm Mike Schroeder, founder and president of Roundstone Insurance. Well, welcome to Healthcare Forward. I'm Mike Schroeder, and I have a special guest, Kyle Sell with Omada Health. Before we jump into our conversation here, Kyle, tell me, who is and what does Omada Health do?
Yeah, Omada is a digital healthcare solution focused in the cardiometabolic space. When I say cardiometabolic, I want you to think conditions like obesity, hypertension, diabetes, musculoskeletal, cholesterol, those large cost drivers, those ongoing chronic conditions. And really, Omada was founded 15 years ago by our founder and CEO, who was in Harvard Medical School. Understood that the current system was broken. It was not serving members. And we understand that the majority of a member's health outcomes are determined in between those doctor's visits. And so in order to reach those members, Omada has really pushed forward and this combination of technology supporting human-led care. So we deploy a digital solution for members across the country to help manage and progress their chronic conditions. It's delivered through a mobile app with the support of human-led care teams, connected devices, all of the nutrition and activity tracking that really moves the needle for individuals on their chronic condition journey.
So we're going to talk a lot about what Omada Health does, and there's this idea or term called managing risk. But then there's also an idea of how that's different than cutting costs. So I think before we jump in, let's chat a little bit about how those two things are different. You know, when you say cutting cost, what do you mean? And when you say managing risk, what do you mean?
Yeah, I think it's kind of this idea of a short-term vision versus long-term vision. So there's obviously budget pressure trend for medical and pharmacy is double-digit year over year. And so there's a pressure for an organization to understand how we can manage that budget. But when you think about risk typically accumulates over time. And so it's a matter of kind of how do you look at that long-term vision versus the short-term needs of the business. And so at times those can be in conflict. And at times I think with savvy benefits leaders, they find a way to kind of walk that line and meet the needs of the business while supporting their member base, especially kind of what we're talking about today around chronic conditions, where things kind of that risk builds and accumulates over time. So it's a challenge. I have a lot of empathy for those leaders that are tasked with managing near-term expenses, but also have an understanding of what this looks like in the long term if they're not being mindful of the risk that's accumulating for the plan.
You know, that's a message that we're constantly sharing. When you get with cost cutting, changing the network or changing the plan design or even changing the insurer, that's really a short-term approach. Doesn't always work. More often than not, it doesn't. And it's also very transactional, sure. Whereas opposed to what you're mentioning here is, hey, why don't we look beyond just 12 months?
Yes. Yeah, absolutely. And one of the things is that, kind of when you're talking about long-term risk, and I think this is, where Omada really stands out, is it's kind of turning the traditional healthcare system on its head a little bit. We're thinking differently. And so when you're talking about those cost-cutting measures, that's still playing in by that old rule book. And I think the rule book is evolving and changing. And so maybe sometimes those steps are required to provide some immediate, relief on budget constraints. But it doesn't solve the problem. To your point, it's a temporary fix. It might help us out today or for the next 12 months, but when you're looking holistically at a benefits plan and risk across the population, you have to zoom out a little bit and think about some different measures that need to be taken.
You mentioned chronic conditions, so let's start with what are they? What is a chronic condition?
Yeah, chronic, you think acute, you think chronic. So, something acute would be, I'm doing a landscaping project and I sprained my knee. It's a flu, it's a COVID, kind of where it comes and goes. But what we see, and we know that 80 to 90% of claim spend is around chronic conditions, these things that are pervasive, these things that develop over many, many years and they last many, many years. So heart disease, leading cause of death in the United States, diabetes, obesity, mental health issues, even MSK issues, like I mentioned, an acute issue coming off of an activity, but we see significant chronic MSK issues, low back pain, ongoing, hip, neck pain, those sorts of things that can exacerbate some of these other chronic conditions that I just mentioned because it gets in the way of a member's health journey. So if they're dealing with obesity and an MSK issue, that they have a tough journey ahead because that's going to really limit their ability to start moving their body and getting active in their efforts to bring their BMI down.
Hypertension.
Absolutely.
Yeah, that's one too. Yeah. So the idea is that those type of conditions lead to episodes of care more often than not in a hospital.
Yes.
If they're ignored, if they're not taken care of. There was a statement I think I saw with Omada Health that the majority of care happens between doctors' visits. And can you explain what you all mean by that?
Yeah, it kind of goes a little bit back to what I was saying of kind of like the old rule book of healthcare. I think the traditional approach to healthcare is very reactive. It also puts a lot of the burden on the member. I think we've all been in those open enrollment meetings. It's confusing. It's challenging to understand where to go, who to go to. And the way that the system is set up is a lot of that responsibility is on the member. And so it's pretty easy for a member to not see their primary care physician for a couple years, even if they're going, best case scenario every 6 months. That's a pretty limited amount of time in a room that's pretty small where you're in and out. I think a lot of folks can understand that when you walk out of that doctor's office, you probably have more questions than you do answers. You feel less confident than when you walked in there. And so that gets to this idea of what is happening in between those visits. And we know about 80 to 90% of a member's health journey and health outcomes are determined in between those visits. And so that's really where Omada was founded. If you hear our founder and CEO, Sean Duffy, talk about his vision for Omada 15 years ago, he was in Harvard Medical School and was, learning about what this looked like. And he's like, there has to be a better and different way. And so Omada is really anchoring itself on that in-between visit care, not replacing those visits because those are still vitally important for a member's health journey. But we know that the journey does not stop the second that they walk out of that physician's office.
And it's really targeting those chronic conditions. So it's not the entire population of a employer. It's those who are exhibiting or experiencing some of these chronic conditions.
Absolutely. But that number's growing.
Okay.
And that's the problem. Unfortunately. And so that's our ultimate mission and goal and vision at Omada is to bend that curve of chronic disease. That trend is going in the wrong direction. And with, all the, advancements in technology and medicine, access to care, eliminating food deserts, those sorts of things, it's still getting worse. And I think it's because we're still kind of in this legacy healthcare model where it's very reactive. The burden is on the member. And that's really where, Omada has kind of carved its place in the market is supporting those individuals across that cardiometabolic spectrum in between those doctor's visits.
So you engage with an employer, through their TPA like Roundstone's Bywater. Mm-hmm. And how do you get in contact with the members that could use your help? How does that happen?
Yeah, it's a multi-pronged approach. So we're enabling and empowering that employer with resources, collateral. We have a full in-house marketing studio where we're able to produce all of the necessary content. And then on the other side of that, we're able to do direct-to-member outreach. So we're able through the partnership with Roundstone Bywater ingest addresses and email addresses and that sort of thing and push out communications directly to the member. We know that with any sort of buying behavior, whether it's healthcare or buying a pair of shoes off of Amazon, it takes a lot of touches. And especially when we're talking about a member's health journey, there's oftentimes a lot of psychological resistance, some cognitive dissonance where maybe they've tried a program or something, to them that seems similar to Omada, maybe haven't had success. And so we know that it takes a lot of touch points, outreaching to that member, building that brand awareness, building that confidence so they're able to take that step. And it's, we make the application process incredibly seamless and easy, but we really lean on the employer group to our partners here at Roundstone Bywater to spread that message. And then we kind of do our part on our side, pushing out those emails and direct mail campaigns.
Once you engage with a member, and let's say that member is, has some weight issues and some cholesterol issues, and kind of the typical thing you see a lot of these folks that, and they're on a one-way path to a more severe medical condition that, how do you help them? I mean, is it just simply sending them materials to read, or how do you engage with these members?
We're very mindful and very intentional about what, especially that onboarding experience looked like. So I mentioned the application process. We remove a lot of the resistance because we know at any point in time, life's going to happen for that member. And we have a very unique opportunity where they have the time, they have the energy, they have the motivation to take that step in their health journey. And so we want to capitalize on that. And so once a member applies, we kind of prompt them to download the Omada app, and that's where all of their care is delivered, is through the app experience. So we kind of lean into this technical, kind of technology mobile app experience, but then that's complemented by a human-led care team. So depending on the specific condition that a member comes into Omada with, they're supported by a health coach, a cardiometabolic specialist, certified diabetes education specialist. So, that tandem right there, you think of a health coach as kind of supporting the lifestyle aspect of this behavior change. And then the cardiometabolic specialist is really looking at it through that clinical lens. So what's happening in terms of their medications. That is also paired with connected devices that we provide to the member. So these ship right out to the member as soon as they enroll. Let's think of a connected scale, blood pressure cuff, continuous glucose monitors, blood glucose monitors. All those are shipped directly to that member's door, and they are all equipped with cellular chips. So when that member steps on that scale or puts that blood pressure cuff on, that reading goes directly into their account. And that's great for them to have some accountability on how their blood pressure readings or blood glucose readings are trending. But it's also incredible information for our care team to leverage to have ongoing communication, set goals with a member, have them start tracking a breakfast once a week, just to understand, have them start taking a walk 10 minutes after lunch, those sorts of things. So it becomes a very holistic experience. We have content around sleep, stress management, mental health. So we're testing for symptoms of depression and anxiety as a member comes in. And so we're unlocking additional features as these members come into the program. One last thing on that note that I think is worth calling out. We have accreditations from many of the largest accrediting bodies. As I was driving in here, you see signs of Cleveland Clinic. So Cleveland Clinic is accredited by many of the largest accrediting bodies. So is Omada. And so there's this element of staying rooted in clinical rigor and doing things the right way, but understanding that needs to be personalized and tailored for the member. So there's this clinical foundation, but then members are able to kind of choose their own adventure as they come into the program. Again, capitalizing on that excitement and momentum that they have as they enter into the program. And so if there's something in particular that's really capturing their attention, we want to jump into that. We want to surface content around that. We want the care team to know that that's a particular interest of that member. And then that's how we're going to really generate that excitement, that momentum, and really keep them engaged for the long term.
How many, you have a number, how many folks at a company, members at a health plan, need these services? Do you have a percentage?
Yeah.
And I know it's growing, but,
Yeah, we know, depending on the specific condition, I think some of the latest statistics, about 40% of individuals qualify as obese based off of BMI metrics. then there's, a pretty high percentage of those individuals then that are dealing with hypertension, diabetes diagnosis. And so there's, I kind of think of it as these overlapping prevalence rates where none of this is happening in isolation for this member. If they're dealing with one chronic condition, it's most likely that they're dealing with two or more, which complicates the journey and can be kind of deflating for that member. And so how do you kind of overcome, like I said, some of that resistance, some of that, feeling of being defeated, like there's no hope. And so there's this behavioral health component that I think is really powerful. That's how you build that intrinsic motivation, how you increase self-efficacy so members feel like they're empowered on their journey, that there is hope for them. And I think the Omada program as a whole does an incredible job of really bringing that to the surface for the member.
Yeah, let's talk about outcomes.
Yeah.
I asked our folks to give me some statistics that they had with the members that we insure and their work with Omada. And one that really just jumped out at me was that 70% of the members after 6 months were still maintaining the weight loss they experienced. And the weight loss is pretty dramatic, more than 5% of folks' body weight, so. It's obviously the outcomes you're trying to avoid are the heart attacks and the strokes and kidney failure and all that. But along the way, there are some measurements to let us know, hey, is this working?
Yeah. We think of those as, it's kind of this layered approach of leading indicators and lagging indicators. Ultimately, the lagging indicator is claim spend. But then we kind of step back a little bit. We're looking at ER visits, inpatient visits. Is a member able to start titrating off of some of their medications based off of the lifestyle changes that they've made? So those are kind of, again, another kind of leading indicator to this reduced claim spend. But ultimately, to get there, we have to move the needle when it comes to weight, when it comes to blood pressure, when it comes to A1C, blood glucose levels. And then if we go back another step, we have to have them engaged in order to make those lifestyle changes. So you think of it as this funnel, it's this process to move the needle ultimately for an employer group that's looking to mitigate risk and reduce claim spend. But you mentioned some great statistics there that, for your groups and your members in particular at, 6 months, they're losing 5%. We know 5% is a very clinically significant threshold for weight loss. That's about a 50% risk reduction for developing long-term chronic conditions, especially in our prevention program. So, that prevention program is designed to catch people before that official clinical diagnosis. And so if we can get people to reduce their risk of that official clinical diagnosis by 50%, that's phenomenal. But those individuals that already have a hypertension diagnosis, we're seeing about, a 10-point and 5-point reduction in systolic and diastolic blood pressure. And then in the A1C space, especially for those that have an A1C coming into the program north of 7, we're seeing about a 1 to 1.5 point reduction in that A1C. And again, that's all impressive, but that's a step in that journey to reduce those ER visits, reduce those inpatient stays, reduce those more catastrophic cost-driving cardiovascular events.
So how are you guys doing it? Is it diet or is it exercise or all of the above?
All of the above, all of the above, and unique to each individual.
Okay.
I think that second point is vitally important. It's not a cookie cutter program. I think, anybody who knows anybody that's tried a diet that's pretty strict, tried an exercise routine that's really strict, knows you might get some initial results. It's just not sustainable. And that sustainability is, I think, what really moves the needle in terms of that risk, but also what empowers that member to take control of their health journey. And so what we're doing, we don't want to just achieve outcomes at 6 months and kind of walk away from the situation. We're empowering that member, especially in the prevention program. I kind of, frame it up as like we're kind of trying to fire ourselves from that member's health journey. Right. We want them to be equipped. We want to give them the tools. We're not trying to be a crutch forever, especially for those folks in the prevention program. 6 to 12 months, we would absolutely love for them to gain all the skills, all the confidence, all the knowledge, make those lifestyle adjustments, solidify those habits, and say, thanks, Omada, I'm good. I'll circle back if I need help, but I'm on a better path and a better journey ahead.
All right. Well, that's one of the things that I find just encouraging is your work with us is kind of a new venture in that, historically you've built your business, and I know you guys are doing fantastic. I think I heard you're going to be going public, so it's just
We did last year.
year.
Yeah.
So, it's just growing fantastic. But you typically have worked with larger companies, 5,000 employees or more, where, at Roundstone, our customers that we work with tend to be smaller, 100, 200, 300 employees. So let's talk about that. Why did you make that decision, and why did you look at Roundstone and Bywater as a good way to reach that market?
Yeah, it's a challenge. And I, prior to Omada, I was in that down market space, those 100, 200 life groups. I know the challenges that they face in gaining access to a solution like Omada. And so for us, we obviously as an organization have anchored on upmarket, larger clients, relationships with PBMs and medical plans for pull-through contracting, really kind of achieving that scale to allow us to go public, to allow us to bend that curve of chronic condition. We had to kind of anchor on upmarket partnerships. But we know that there's a lot of folks, a good majority of folks that work for smaller organizations. And when you think about the challenges that a smaller organization faces compared to a larger organization in purchasing insurance, to spreading that risk, and kind of just navigating the benefits ecosystem, a lot of the down market cardiometabolic solutions, there's fixed fees involved, and that becomes incredibly challenging for an organization. And so, when the conversations initially started up with Roundstone and Bywater, I was incredibly excited because I come from that space and I know the challenges that those employer groups and those members face. And so we're coming up. I think we're just over a year now, and excited for what we've built so far, and excited for the future to come. But it gives us access to those smaller organizations, but it allows us to operationalize that. And I think that's the challenge that we have if we were going to do kind of one-off relationships with these smaller groups. It's just challenging to operationalize a partnership like this, but through the partnership with Roundstone, we're able to kind of facilitate that technical implementation, all that stuff that needs to happen in the background to give these members access to a program like Omada. Roundstone and Bywater have been incredible partners to allow us to structure that.
That's great. We're big fans of really tackling, healthcare costs under plans with a variable cost approach. And we believe the more variable costs you can have when you go and apply things like Omada, then it stays with the employer and the employees. So, it's to me just, great. All of Bywater's customers have access to Omada. It's in their plan document. But then again, they only pay for it when their people need it and when they take advantage of it. And that's so aligned with our approach to how you manage efficiently a health plan. So we're just thrilled to have that relationship. Let's talk a little bit about the psychology. Obviously, large employers, 10,000 employees, if they can move the needle, 40% of their population has metabolic syndrome or issues like that related to that. When folks go into a captive, when they self-fund, they kind of start thinking, if you will, a little bit like one of those larger employers. What's your perception of that? Is that a good impression that I have?
Yeah, it's where the risk lies, right? So as soon as you venture into that self-funding space, even if you layer on, spec deductibles, aggregate deductibles in that stop loss space, you're still carrying the full freight, or not the full freight, but a good portion of that risk. And so that changes the way that benefits organization thinks about supporting their members. I think back to kind of our earlier point of what are we anchoring on, kind of the old way of providing healthcare or a new evolved way. And I think part of that calculus for a benefits team is, where does the risk lie? If we're just paying a premium and the risk kind of gets back to the carrier, that's a different calculus. But if you're venturing into that self-funding space, now all of a sudden you start to consider those things a little bit differently. The other variable that I think is important to note here is understanding the workforce, understanding the population. We see a lot of these organizations that are hire to retire. And so you're holding on to that risk for a longer period of time. If you have high attrition, high turnover, maybe you think about it a little bit differently when it comes to the chronic condition space. Not that it's the right way to think about it, but it's kind of like, well, that's going to be somebody else's problem because that member is maybe going to move on. But for an organization, I think we see this a lot with these smaller organizations. It feels like a family. There's a community there, and people stick around, and you have fathers working next to sons. And so, that calculus changes in terms of how you're offering benefits, how you're supporting members in their health journey. And so while there's kind of a math equation, there is that psychological component of how do we want our members to feel about the benefits plan that we're offering. You get into this realm of total compensation statements and really highlighting and showing what is being provided to a member. And I think when you can layer in solutions like Omada, it shines. It shows that, it kind of speaks to your member population. We care. We want you to take advantage of these programs. That we would be excited to offer something like this and pay for it on your behalf. We want this for you.
So, I want to chat a little bit about, our food system in the United States. We've had a conversation with a guest on Healthcare Forward here, where, is very much about eating, vegetables and fruits and being a little smarter and staying away from the processed foods. I mean, a big part of the reason there's so much metabolic syndrome is, that number just keeps jumping out at me. 40% of is because of the way folks eat and they don't exercise and so on and so forth. And, Jumpstart was the name of that organization, and we're big fans of it. What are your thoughts on that? Can you beat it? Can you beat the system? I mean, I do know, there's all kinds of cool. There's a great farm here in just west of us, Farmer Jones, where you can get natural food and vegetables. But it's tough. It's just so easy to just go and get a Chick-fil-A or something. You know what I mean? What are your thoughts? Can you beat that?
It's really hard. I think you can.
Yeah.
It takes time, takes energy, takes financial resources. It also kind of gets into this conversation of social drivers of health. We know a lot of individuals, it might take them 30 minutes to get to a decent grocery store to get vegetables and fruits. So they're stuck with a little convenience store, maybe a little fast food joint, and life is busy. We're everybody has a lot going on. I think that's a pretty common thing. You say, hey, how are things going? Busy. That's just kind of like a default response now that everybody has. And I think it's true. I think it's true for everybody. And so, this idea of, getting home, having the right groceries in your refrigerator, the time and energy to prepare those groceries in a healthy way to sit down and eat. Unfortunately, I think that's an exception and not the rule. You can make it the rule, but that's going to require a whole lot of effort and energy. And so, that's kind of circling back to how Omada deals with that. We're very realistic. I've seen, conversations between a health coach and a single mom, where it's in real time, where they're talking like, hey, the kids are sick. I just had to go to McDonald's. Like that was the thing I had to do. And the care team leading with empathy, like, oh my gosh, like I understand, hey, if we need to kind of take a little break and we'll circle back next week, or I'm happy to support. You have these goals there. I think there's a way to kind of accomplish both. And maybe it's a grilled chicken salad as opposed to the double quarter pounder at McDonald's. And so even when life is busy, even when maybe resources are limited, there are some choices. They're not necessarily always the fun choice or the easy choice, but that's part of really supporting and empowering the member to make those choices. It's easy to fall back into old habits. Cheeseburgers and French fries taste great. They are fine in moderation.
Right.
So it's what are you doing? The other 80% of the time that you're taking in food.
Sounds good. So, any success stories you like to talk about, and certainly on a member level, I'm sure you have them, but what about on an employer level?
Yeah.
Anything you want to share with us in that area?
Yeah, it's one of the things that we, just like Roundstone Bywater, have relationships with large consulting firms, and their job is to fight on behalf of the client. That's what they're there for, to get out into market and negotiate and make sure that that client is supported. And some of the most exciting, stories that I can remember is when, probably, maybe a little skeptically, a consulting firm has said, "Can you send over some of that utilization data? Can you send over some of that outcomes data? We'd love to run that through our ROI analysis." And you get a little like, okay, well, we can't control that. They're using their own model, their own analysis. And I've had 3 to 4 times now where that has come back and they're like, "You guys were right. You were right. We pushed that through, our internal health economics team, and we are seeing kind of an altering of risk and claim spend for this group. You guys are onto something here." Right. And so those types of stories, I think, are incredibly encouraging. But that also is at this higher level, this aggregate level. Mm-hmm. I was on a call just a couple days ago with a really large enterprise group talking about doing a population expansion and kind of what would this look like to roll out Omada programs to some of their different health plans. And I was able to pull in a testimonial. And a couple of things that jumped out to me from this testimonial of the single member. Again, we go from this aggregate, large numbers, down to understanding that this is somebody's life. This is, they're a mom, they're, a daughter, a sister, an aunt. They want to lead a happy, fulfilling life. And, one of the things that jumped out in this testimonial was a lot of gratitude, lot of gratitude to the employer. Thank you for offering a program like Omada. That pulls on my heartstrings because I can empathize with that individual, and what that means in terms of their impression of what the care and concern that her employer has for her. But at the bottom of the testimonial, it says, "I've been on this journey for 20 years, and I have accomplished more in 1 month with Omada than I have in all 20 years."
Wow.
She said, "My blood pressure is coming down. I'm titrating off my medication. My blood sugar is under control." And her last comment was, "I'm walking better."
Wow.
And so you can imagine what her life was like 2 months ago.
Right.
And some of the limitations that she was experiencing, not to even mention the stress. There's kind of this new metric that's coming out called diabetes distress score. It's above and beyond depression and anxiety, but it's this looming just weight of a diabetes diagnosis. And so I think about that for this particular individual, and she's walking better.
Right.
And
Great.
That's phenomenal. So yeah, those are the types of stories that get me excited to have these types of conversations.
Right.
and show up to work every day and support these groups.
A job where you're helping others is the best job out there.
Yeah.
It's Roundstone has our mission of quality, affordable healthcare, and it's all about letting our folks know that the work you do is real important.
Yeah.
You mentioned something about utilization.
Yeah.
And when I was getting ready to speak with you today and I was looking at our experience with you, I was really impressed because, listen, in this space where there's all kinds of solutions to help groups get healthier and help groups manage risk and help groups cut costs, a lot of good ideas, but sometimes they fall down with utilization. You can't get the members engaged. You guys do a really, really good job. In fact, the number just jumped out at me, and I kind of was almost in disbelief. Why? I mean, how are you guys so good at getting the folks that need your help to actually work with you?
I think the number was 10 a week.
Yeah.
So the average member.
6.5 times per week.
6.5 times.
Yeah, that's a lot.
Yeah, one time per day.
I'm just trying to think of what I do 6.5 times a week, and I can't think of it.
Yeah. So basically one time a day, right?
Right.
That member is utilizing the Omada offering. And that looks different for each member and each day. One day it might be using that connected device that I referenced. The next day it might be entering in a goal or taking a picture of their breakfast and allowing our AI technology to analyze how much fiber is in that meal, how much saturated fat is in that meal, and providing that level of education. It could also be the member, after tracking their blood pressure for 3 months is getting ready for a visit with their primary care physician. So they're going to export that data, email it off to their provider, and go in and say, hey, look at, provider, look at all the work that I've been doing over the past 3 months. And so those are just some examples of ways that we engage the member. So I mentioned before, there's this clinical rigor as the foundation, but then it's fun, it's exciting. There's this gamification component where members feel excited, they feel supported, they set a goal, they wanted to take a walk after lunch 3 times this week, and they get to go in there, and that feeling of like, yeah, I did it. And then the coach sees that and they reach out and say, great job, Mike, you did it. You set a goal. You did it 3 times this week. Like, what's the next thing we're going to accomplish? And so, my background's in psychology. That's where I was trained, undergrad and graduate. And so I think of, if you look at the 2 key components for behavior change, the top driver is self-efficacy. Mm-hmm. My belief that I can do the thing. Mm-hmm. And so, like I mentioned before, a lot of folks come in pretty defeated, pretty beat up, feeling like they're the problem, that everybody else has it figured out, and that it doesn't work for them. They can't figure it out. And so you start stacking on some small wins day after day, and that builds momentum, that builds excitement, that builds self-efficacy. And now that member is no longer externally motivated, they're intrinsically motivated. Mm-hmm. And that changes a person in the way that they move. And so for me, that's if you're asking about the secret sauce of utilization and engagement, it's that behavioral health component. We're talking about connected devices and A1C readings, but the only way to get there is to impact the individual's behavior and the way that they think and operate and the way that they make choices. And once you stack on some good choices, then that starts to become the norm. Those become habits, and that member's off to the races.
I sit back here and I reflect on our conversation and what Omada Health is offering. So, you have a big problem, right? The chronic conditions are just creating more and more healthcare costs. You have a solution that, works. The outcomes are there. They're supported. You're able to get folks engaged. You have a model where an employer can make it available through Roundstone Bywater and only pay for it for the folks that need it. Yeah. You only pay for what you use. It's not like cable TV where you get a bunch of channels that you never use and you're still paying for it. I think of why don't all health insurance plans have this approach? Because to me, it's a win-win. Yeah. You have any thoughts on why you think more people aren't doing this? And I have to share, when I reflect on our employees here, for those who could use Omada's help, and clearly there are some that could, I feel good that we're making Omada, and I know we're going to follow this conversation, and you're going to go down and speak with all of our employees and let them know about the resource available to them. And as the the president, founder of this company, I feel good that they can take advantage of Omada. So to me, this seems like such a no-brainer that should be part of any benefits plan, but it's not. And so folks, they can find it if they come to Roundstone and Bywater. But what are your thoughts on why the marketplace doesn't embrace more of this?
Yeah. We put in a lot of work to get this stood up for you all. There was lots of conversations. Our typical model is, kind of a health plan pull through with, a big BUCA plan or a large PBM where there's all the integrations and it's smooth and easy. We had to scratch and claw a little to get this stood up. And so, absolutely, kudos to you and your team for trusting us in that journey. And, it's something that, we were excited to do. And I was a champion for Roundstone and Bywater and, internally at Omada, because it did kind of break our mold a little bit. I'll continue fighting the good fight internally because I believe in what we have here. But you can appreciate that, an organization might look at a solution like Omada and ask a question like, wasn't that what the health plan's for? Right. We have care advocates. The member can call in. We can, do a find a provider search online. That's good enough, right? We don't need to go through this extra effort to deploy a solution like Omada. And so, and I think, again, that's a consequence of kind of this legacy thinking around healthcare. You all are ahead of the game in the way that you're thinking and the solutions that you're providing to your employer groups. So very commendable on your part, but I can also appreciate, other organizations that are kind of maybe resting on their laurels a little bit, kind of stuck in that old mindset where we'll just tweak some plan design stuff. Hey, employer, why don't we adjust the contributions a little bit to make it a little bit easier for you and shift some of that cost to the member. But again, we're talking short term versus long term. So these types of offerings are not easy to stand up, and so I think that it maybe scares some folks away, and they want to just kind of lean on. Well, that's what the health plan's for. That's why we have preventive care at no cost. That's good enough. But what we're seeing is that it's not good enough.
Well, I want to say thank you for the hard work and the time you spent with our team to stand it up and. And the hard work that you and they did to make it easy for our customers and our employers and their members, that's nice, and that they can access this so easily. Yeah. And I'll end with if you had to share one bit of advice with an employer who's running a health plan for their employees, what would it be?
Yeah. I think this is a little cliche, but be the change that you want to see. I think it starts at the ground level. It starts with employers thinking differently and putting the pressure on the carriers, on the PBMs to evolve and to shift. I'm having these conversations every single day of a new partner comes into the mix in an employer's benefits ecosystem. It's like, let's sit down and talk. Let's dream. What could this look like a year from now, 4 years from now? And where are those opportunities to integrate and push things forward? And so, I think a lot of times, employer groups, especially smaller ones, are a little on their heels. They struggle to understand how they can really create that change and have a vision. And so, empowering those benefits leaders to make those decisions, to have those tough conversations, to put out those challenges, to say, this is what we want it to look and feel like. As opposed to, again, falling into that trap of that legacy model of just kind of here's your renewal. You want to, if a broker's bringing it in, do you want to shop it or not? And that's going to be pretty disruptive. Should we take this 12% renewal and just kind of move on with life? And so, I appreciate Roundstone and Bywater being a voice for those employer groups to say, hey, come over onto this side. Let's explore what a self-funding solution would look like. And then you have power. You have control, you have a voice because you're holding that risk. And so, that empowers them to be that change that they want to see for the health plan and for their members.
Well, in no insurance world will you see folks with more diabetes, more heart disease, more hypertension enable or allow for a lower health insurance renewal. It just doesn't work. So, those short term, you have to approach this long term. There's just it doesn't work. The more of your population that develop these chronic conditions, the more you're going to pay, and I don't think anybody can argue with that. So, Kyle, I appreciate you spending some time with us here at Roundstone, and look forward to a very fruitful and growing and wonderful partnership in the years to come. Thank you so much.
Yeah, thank you, Mike. Appreciate it.